Good morning, everybody. Scott Maybor here with your Medicare Missive from the pond for Wednesday, the 1st of April. Hope you're doing well. Spring-like day here in the Boston area, although I understand tomorrow's going to be in the 40s. Let's see. Happy Seder to the people celebrating. Today, I wanted to talk about a couple things. One, somebody asked me not too long ago, what do I get when I hire you? Yesterday I submitted 3 applications, one of which I'll talk about, but 3 applications yesterday at 9:30 p.m. for the March 31st at midnight deadline. In one case, the woman is on an injected medication. Her Advantage plan refused to pay for it. They want her to do step therapy and some other things. But it's a Part B drug because it is injected by a healthcare professional. And I said, if you get a supplement, it's Part B, you'll get a supplement, you'll pay nothing. If you continue with the Advantage plan, one, we don't know what you're going to be charged. So ultimately, even when they do approve it, are they charging you for an office visit? Are they charging you for outpatient surgery? Are they charging you for X for the drug? You don't know what the copays are, and it's very hard to pin down the carrier until they get the bill because they don't know what the provider is going to bill. So you're really guessing. And I said, it would probably be much easier in terms of approvals and in terms of no copays to just switch to a Medigap plan. I was traveling last week. I came back. She had called me yesterday morning, and I somehow missed the message. I called her last night about 8 o'clock. We connected around 9, and we got that submitted for her for effective at midnight today. The other gentleman is a follow-up call, or not a follow-up call, a follow-up video to somebody I had spoken about when I was away. He and I did a joint call while I was out of the country with Social Security to try to get them to process his application. And this is a warning to all of you. We submitted his application the second week of February for April 1st. Never heard. Called several times. The last person we spoke to, which was last Wednesday, I believe, or Thursday, said, yep, we got everything we need. It's been assigned to a person who handles it, a processor. And I have no idea why it's taking so long, but I will send a note to make sure that it gets processed. Okay? I checked on it Monday, so the 30th of March. Still processed from April 1st, which was the requested date. And he retired yesterday. Checked on it Monday, still not processed it. Checked on it yesterday morning, still not processed. We spoke to somebody, so we did another joint call with Social Security, and I will say they're very nice and very helpful when you get someone on the phone. But sometimes it's more effective than others. The woman we spoke to yesterday said, you applied for this quite a while ago. Let me just take care of it for you. Now, she mentioned that it has been assigned and they have everything they need, but the office that it was assigned to, which is based upon where he lives, is very busy. They get a lot of requests, a lot of paperwork. It's a busy office, and they're just behind. Well, that doesn't help him since his insurance ended yesterday at midnight. But think about this. Multiple calls to the office. Everything's in place. We just haven't processed it yet. We finally get this woman on the phone, and she's like, I'll just do it while you wait. It literally took her 3 minutes. She's like, yep, let me just send that through. Yep, check, done. She's like, it may not show in the system for a day or so, but you are all set as of midnight. It's mind-boggling to put somebody who applied, did everything right, submitted everything on time, not missing anything, no incorrect information, already had his Part A, so we already knew his Medicare number, and waited, and basically if we hadn't called yesterday, it still wouldn't have been processed. Now, they may have processed it next week or the week after and retroactively gave it to him, but that leaves him with 2 weeks of unknown. Maybe he pays for Cobra, which is very expensive. Maybe he cannot get a supplement or Medigap plan or an Advantage plan retroactive, so he's still got, a month of no additional coverage. It's just mind-boggling and frustrating. please do not wait till the last minute to apply for your Medicare, to activate your Part B or apply for A and B. Things happen, things get delayed, and sometimes it's because there's a transposed date of birth. Sometimes it's, there's a typo in your Medicare ID number. And sometimes it's entirely on them. You can do everything right and still not get processed as you should have been. And it's maddening, it's frustrating, and it's scary if you need the health insurance, because he has a medical procedure coming up next week. So let me know if I can help. I am here for my clients. So for those of you who say, why hire Scott when I can, do it myself? Fine, no hard feelings either way. But if you run into trouble, great. I mean, I did speak to another person that was referred to me while I was away. She chose a plan because I was away. She didn't want to wait. She chose a plan for her mother, which I don't think is the right plan. Hopefully it works out for them. It's not what I would have recommended. But, I told her we can talk again, but, time is short. So let me know if I can help. Be well. Enjoy the Seder if you're Sedering, and let me know if I can help. Thank you very much for watching.